Hello, friends. It's Carla, your online doctor, with today's Live in 5. Today is Tuesday, July 7th at 5 p.m. If you missed yesterday's talk on CBD and COVID 19, scroll back and find it because I think it kind of opened people's eyes to some alternative options, including CBD, to treat COVID 19 or to help along with other things, again, not by itself. So it's pretty cool. And I have a couple of friends who are getting themselves some CBD, and it's going to be really exciting for them. And I'm happy, not because they have COVID 19, but because they need it for other things. So please reach out to me because I got the best product ever. And if you're concerned about the THC, it's got none because I can't have it either. So it's all good. Okay. So today we're talking about the CDC has expanded the possible coronavirus symptoms, okay, to include congestion or runny nose, nausea, and diarrhea. Okay. These join the federal agency's list that already include fever, chills, cough, shortness of breath, difficulty breathing, fatigue, muscle aches, headaches, loss of taste or smell, and sore throat. Okay, they also say that symptoms can range from mild to severe, with most people experiencing symptoms between 2 and 14 days after exposure. Well, seriously, are they trying to include every possible symptom someone might experience with any respiratory virus, or simply scare the crap out of us all to think every ache or pain or literally every cough means you could be infected? Okay? The list of symptoms are so vague and so widespread that they're casting this huge net so that they don't miss anybody. Okay, so understand that there will always be outliers. There will always be people who have symptoms outside of the norm. But if you don't have a group of symptoms, if you just have one, if you just have a sore throat, or you just have congestion, or you just have a headache, don't get yourself all worked up that you have it, because nobody wants to have it right now, right? Okay, so I think most people understand that by now that fever, cough, and sore throat may be the most common. But overall, if you're not feeling well, stay home or get tested at this point. Okay, those are your options. Okay, unless you're feeling really sick and need the hospital. If you think or you know of an exposure that you've had, or you think you might have gotten exposed, then stay home. Okay, if you don't want to stay home and you have some of these symptoms, then definitely get tested. Okay, anxiety is probably one of the worst things you can do for your immune system, and right now we need our immune systems to be strong. So if you allow anxiety to get into your head, this and this is all connected, and you will weaken your immune system by being stressed out and anxious about whether or not you have it. Now, the other problem is the availability of testing. Quest and LabCorp are reaching capacity for testing, according to the latest articles I've read. Daily capacity, okay? Not only are hospitals testing all patients with now all of these type of symptoms, but they're also testing every preoperative patient. Now, the hospital where I work just canceled all elective surgeries again. That's Broward County. And Miami-Dade, I'm sure, has done the same because of the spike. And I wouldn't be surprised if it starts to spread to other areas of Florida that are seeing these higher numbers, because hospitals are getting closer to capacity, not just with COVID patients, but because they're having elective surgeries and people who need to be hospitalized for that. So if they remove that as a variable, then there's more room in case there are more infections. Now, the general public is also testing more, especially, again, in the states with climbing numbers, since your exposure risk is definitely increasing. Now, also, employees are testing all, employers are requiring their employees all to get tested. Nursing homes, senior living facilities, they're all testing their residents. I know my parents are getting tested every other week, and the staff are getting tested, I believe, every week. So this is just to show you that the tests are out there and they're available, but the more people that are getting testing, the harder it will become over time again to get tested. All right, so don't wait until you absolutely feel you have to get tested. I need it today, because you may either have to wait a long time, or you probably should make an appointment someplace so that you kind of have your set spot. Because once they fill up those appointments, they know that's their testing capacity. Okay, my daughter's college, for example, is going to be testing all students as they move in from off campus, right? Students before classes even start. That is 60,000 students, not to mention faculty and staff, who are all going to need to be tested. Now, that's just one university in Florida. So if you think about that across the board, as we get into August, a lot of these schools are going to require testing. So where does this leave us? More symptoms to think you could be infected, yet testing at labs reaching or getting closer to capacity. Should you test if you have a known exposure, or simply self-isolate for 14 days? That's a personal decision. We know testing within that 14 days is not 100% reliable, but I guarantee any symptomatic people are not staying home for 2 weeks, okay? Or I should say not every symptomatic person is staying home for 2 weeks. Clearly, it's a different story if you have symptoms. If you're asymptomatic and you want to stay home for 2 weeks, I appreciate that. But most asymptomatic people are not staying home for 2 weeks. Okay? If you're symptomatic, please, for everybody else's benefit, either get tested or stay home. So especially with the hallmark symptoms, right? If you know you have a known exposure, or you have that cough, fever, weakness, loss of smell and taste, if you have like the most common ones, stay home or get tested. And again, especially if these symptoms are new onset. If you've never had these symptoms before and suddenly they appear after you've been exposed to somebody or been out for the first time in a while, okay, then you need to get tested. If you've had symptoms like this, if you always have gastrointestinal symptoms, or you always get headaches, or you always are congested because you have allergies, it isn't likely that you suddenly have COVID-19 if you have the same symptoms you've had for months, okay? Now, just as we thought we might be getting a break for the summer, in many states it's back and the numbers are climbing, okay? It's not just the numbers are climbing because of testing. The positivity rate is going up. I know in Florida, our positivity rate back in the end of May was about 3.5%. Now we're up closer to 15% positivity, meaning 15% of all people testing are positive. So even if testing is increased, more people are testing positive. So be smart, be careful, social distance, wash your hands, don't touch your face, and I would suggest wearing a mask. Okay, we're going to talk more about masks as we get through this week. I love you guys. I hope you're having an awesome day, and I will see you again tomorrow for another Live in 5.